Now on Nights, Health Matters, thanks to the Sydney Adventist Hospital. Healthcare, education, research. Yours for life.
There's a bit of everything tonight because each week we speak one of the great professionals from the SAN, and tonight we're going to talk about something that's very specialised, and I'm really in awe of people who do very complex surgery. Our guest tonight is a specialist general surgeon in the fields of upper gastrointestinal, biliary and pancreatic surgery at the SAN. And it's Dr Christos Apostolou. He and his colleague Dr Pillinger will be performing a combined, now listen for this closely, a combined synchronous robotic liver and bowel resection. So it's an operation. It involves incisions, but it's being done to both these organs, it would seem, at the same time. And it's being done, I don't know if it's been done before, using robots, but we'll find out more. Dr Apostolou joins us on the line now. Doctor, good evening to you.
Thanks, John. Good evening. Thanks for having me on the show.
So the use of robots, we know they've been there, but is this the first time that you at the SAN have been using robots for what's a fairly complex surgery?
We have been using it now for quite a few years at the SAN. I mean, the technology has become accepted even in Australia for at least about 5 to 10 years. And the scope of application has increased. This would be a first one in our line of work where we're doing a combined operation involving the colon and the liver at the same time.
All right. So just traditionally, when you do a liver and bowel resection, I'm just reading the words, so I need you to explain what it is for us.
So, John, we're talking about patients with colorectal cancer, and these patients sometimes can present with cancer both in the primary organ, which is the colon, and in the liver. And in those patients, and this is after a discussion with other groups of doctors in something which we know as the multidisciplinary cancer meeting, which we do at the SAN every week, we decide the best course of action. Once that course of action is taken, which often involves chemotherapy, we plan to remove the cancer, which is still there after the treatment, and that involves usually sequential resection of primarily the bowel first, the intestine, and then the liver.
Yeah, and so without robotics, are you doing it by hand without doing it by robotics? Is that how it's been done in the past?
So usually what we have done before would be, so very few of these patients are eligible to have the operation done at the same time.
Yes.
The advantage is obviously that there's one anesthetic for the patient, one hospital stay, and the recovery is much swifter. So we do try and promote this as best as we can. The bonus with the robot is that the incisions are smaller and the recovery is believed to be faster.
Yep. So
that's where the robot under our, obviously, guidance is an excellent tool.
Yeah, because I've talked about this before, and I know I'm in awe particularly of the precision of a surgeon. But now I'm assuming with the robot and the way it works, it's like you're operating the robot a bit. You've got controls, have you, and operating this very precise robot.
It makes us look even better.
Yeah.
So what we can do is, and obviously we can jump around as we go about all the different details and options. But the advantage of the robot is that it magnifies our vision tenfold. It gives us a 3D operative field. So it's trying to reproduce our eyes and hands inside the patient's abdominal cavity with avoiding the bigger incisions and also the bigger retractions, which cause morbidity and delay of the patient in the hospital.
And so I'm assuming the robot looks like a long arm. Is that right? With the
So I wanted to give you a description which is okay for the listeners, but probably looks like a spider with 4 legs, but quite a friendly spider.
Yeah. Yeah.
So there's a kind of a stack, and there's 4 arms that articulate, which go onto the side of the patient and sort of go over the patient without touching the patient, other than at the tip, where it's actually the similar ports that we use for the laparoscopic operations. So they're quite similar. So there's 4 small holes that go into the patient that are about 8 millimeters in size. And that's through those ports that we do the operation.
Okay, look, please don't, I'm going to ask the lay people questions. So I assume without the robot, you have to open someone up so you can see what you're doing?
Yeah, usually for this kind of operation, we'd need to open up, especially for liver resection, we'd have to open up because the robot allows us to almost go around corners and do things that the classic laparoscopic instruments, which are like chopsticks.
Yeah.
Just basically can't go around the corner.
Yeah, and so, and that's why you talk about it being a spider. Inside there, though, has it got a light? How do you know where you are and what you're doing?
So it's got a very strong light and an excellent sort of high-definition camera. And then those instruments are coordinated with the camera, so wherever the camera goes, the instruments follow. So you target where you want to go, and then you can control with your hand at the console. So you sit probably about 5 meters away from the actual patient with usually there's another surgeon on site of the patient just in case there's any issues. And then that through the console, you can actually see inside the patient and do the operation.
Now, my understanding is it's years and years, probably half a lifetime, to get the qualifications to be a specialist surgeon. So with technology like this, you've got to relearn things. How much training has to go in to be able to do and operate these things?
Oh, look, it's a fair amount. I mean, from the point of view, so I've been a surgeon now for close to 20 years. I started the robotics in those days in 2015. We had to go and do training outside of Australia, which was either the States or South Korea. So I went to South Korea. And then after that, a lot of the local training takes place under the auspices of the company that have certain criteria and certain time that you have to spend on the machine, almost like a flight simulator. So you've got to spend a whole lot of hours on a flight simulator and do some exercises. And then when you start doing the procedures, usually it's under a system of what we call proctoring. So a senior surgeon or a more experienced surgeon would supervise you for the first 5 patients. And then we keep a close log of the first 30 patients, which is like an audit to make sure that it all's going well. So it's ongoing sort of learning, but that's medicine for you, That's why we love it.
So you're going to do this surgery on both organs with Dr. Pillinger. So how does that work? Do you have a robot each or an arm each? How does it work?
Yeah, so sometimes, not in this case, like say, for example, if you're working with another surgeon in the same area, you can have 2 consoles, and you can each take an arm, if you know what I mean.
Yeah, yeah.
But in this case, because of the organs we're dealing with are diametrically opposite, so there's one up in the upper, where your liver is sort of under your rib cage.
Yep.
And the colon sort of lower down in the tummy. We will do it sequentially. So we'll place, if you can imagine, 4 holes pretty much across the middle of the body. And then we will first target the operation for what I do, which is the liver. So the robot will aim north. I'll complete my operation, and then we'll move the arms, still keep the same holes on the patient, so There's no difference to the patient. And then we'll move the arms south, and then Stephen can do his part of the operation. So we'll do it sequentially.
Yeah, and it's quite exciting at the sound. I think it's a first there. There's going to be a common procedure now. You're going to be doing more of this?
Yeah, I mean, I think where we're coming, sort of the program is maturing now, and we can offer all the different types of surgery because we all come at it from a different angle, which is excellent for the patient. So we will be hoping to offer this more and more as we go further. And it's sort of a testament to the SAN for the investment of the machines, because obviously it costs a fair amount of resources for that, and then the ongoing service and support of the companies. So it's very exciting.
Yeah. So even with machines though, as a surgeon, and I've come back to what I said earlier, having that very precise capacity to hand-eye coordination. I mean, I'm hopeless on a PlayStation, whatever it might be, but I guess that's something you have to have, isn't it? A physical thing to be able to do that very precise work.
Yeah, I mean, it is part of it, I would imagine, is trained. I mean, I've trained at the time. We were doing a lot of aptitude tests and so on. But it does take a fair amount of, obviously, coordination and precision. A lot of it is planning. And you really got to have a sort of, you really want to have a passion for it, because, I mean, I think that's can reconcile all the long hours and all that training.
Yeah. But I see you're described as a specialist general surgeon, so you do a lot of surgery, a lot of work along these lines. Yeah.
So most of us are like for intestinal surgery, we're all general surgeons, and we specialize. So I specialize in the sort of foregut, and Stephen would specialize in the colorectal system. So there's quite a bit of overlap. But yeah, we have our own little subspecialties, which is obviously ideal for the patient.
All right. Well, as I say, your skills, I'm in awe of the precision of what you can do, and obviously the more progress can be made, and the robotics that's happening more and more, isn't it? The robotics, which make your life easier and mean you don't have to do as much cutting of the patients.
Yeah, I mean, obviously what we try and achieve is obviously best outcomes for the patient. I mean, there's still a role for keyhole surgery and open surgery. There's no key is ideal, but it's just another tool which is really expanding our repertoire and really just trying to get the patients to do better.
Right, fantastic, lovely to talk to you, and I hope I won't see you in an operating theatre sometime in the future. But
maybe we can play some PlayStation.
Yeah, that could be good. I don't think I'd have much of a shot against someone with your hand-eye coordination. Maybe I'll find something else. Golf? No, golf. I think I might. I'll think about it. Thank you so much for your time tonight. Thank
John.
you.
Thanks so much. Thank you.
Dr.
Bye-bye.
Christos Apostolou, he's from the SAN, a specialist general surgeon with a wonderful skill that certainly benefits so many of us.